Hi, good morning friends. Shall we continue our question discussion session? So this is the third video in this question discussion session. I hope you all are practicing well and you are preparing your exams. So we'll start the first question in this session. A nurse who works on the night shift enters the medication room and finds a co-worker with a tourniquet wrapped around the upper arm. The co-worker is about to insert a needle attached to a syringe containing a clear liquid into the antecubital area. The appropriate initial action by the nurse is which of the following? See, this is the scenario. I will reword the question. A nurse, she found one of her co-worker. She is in the medication room, and when she saw that, she closed that room and she just put a tourniquet over her hand, and she was trying to about to insert a needle a syringe which contains a liquid, clear liquid. It might be any kind of medication to the antecubital area. So if this nurse who saw like this, what she will do in this scenario? That is the question. The first option is call the security. Then the second option is call the police. Third, call the nursing supervisor. Then last is lock the co-worker in the medication room until help arrive. What do you think? What would be a nice appropriate action by this nurse? Call the security. Is it necessary? This is the first one she should do? No. Eliminate that. Call the police? No. We are not the right person. Suddenly we will inform the call the police? No. Call the nursing supervisor? Yes. This is something related to our nursing department, and one of our co-workers, she is behave like an impaired nurse. So as per the Board of Nursing jurisdictions of the practice, it says that such kind of impaired nurse should undergo certain treatment, and they should need supervision. So the Board of Nursing, they will develop certain plans and certain programs for these nurses. They might have some issues, that might be the reason they are doing such activities which is 100% against to the ethical rules. So here this nurse, first she will inform about this co-worker to her nursing supervisor. That is the first and best action she can do. Then the nursing supervisor is the right person, will inform to the appropriate authorities based on the severity of issue. And finally the Board of Nursing will do an investigation, a root cause analysis, and all these procedures will go step by step. And another option also we have, that is like lock the co-worker in the medication room until help arrived. In this scenario, question scenario, they are not mentioning, they didn't mention anything about that this co-worker is violent, or this another nurse, she needs some support. Nothing mentioned. So we can eliminate that also. The best option in this question is call the nursing supervisor. So the answer is option 3. Shall we move to next question? An adult client who has a severe mental impairment scheduled for pile surgery. Which should the nurse implement about the informed consent first to facilitate the scheduled surgery? See the keyword here, it is the first. What she should do first to perform or to undergo this particular scheduled surgery. So this question also related to the informed consent. So just think or just on the critical thinking mode and see. We will read the options one by one. First, check the identity of the client's legal guardian. Second, inform the legal guardian about advance directives. Third, arrange for the surgeon to provide informed consent. Then last one is ensure that the legal guardian signed the informed consent. So out of these 4 options, which one you feel that you can eliminate? See the question said that the client, she is severe mental impairment. What we study in the informed consent? If the person or the adult who has a severe mental impairment or chronic dementia which alter their thought process and they could not take a decision because thought process and their mechanisms, everything altered. So they are not competent or comprehend enough to give a consent, enough to give a informed consent. So they need someone else. So someone else have to sign for them. So in that case, we will go with that legal guardian. This client might have a legal guardian. So in that scenario, what we should check? Okay, now we know that this client, she is not going to give informed consent. She is not competent enough to give the consent. So the next option, there is an legal guardian, because in the options they mentioned about legal guardian. So that would be around. So in terms of legal guardian, what point we should remember? The last they said that ensure that the legal guardian sign the informed consent. Okay, this is the right legal guardian, she might be signed, but before she will sign, what I should, as a nurse, what I should ensure? That I should ensure is the right person, this is the right legal guardian. How we will ensure? Yes, we are going to check the identity of the client's legal guardian. In this kind of scenario, we know that the legal guardian is the one going to give the signature, but as a nurse, as a client advocate, I should ensure that the one who is signing as a legal guardian is the right person, or I should check the identity to ensure 2 times. So what is the answer in this scenario? Yes, the option 1 is the answer. That is the first thing that the nurse should do in terms of this informed consent. Then only she, then after, first she identify, okay, this is the correct legal guardian. Then she in front of the patient, with along with this legal guardian, the doctor will inform all the procedures, everything, and the legal guardian understand, and the legal guardian, he will sign for this client. So like the steps are coming. When we will see these options, we will think all the options are correct. Yes, it's correct, but here ask the first thing. Okay, I will tell the 4th option will be the first thing. Okay, I got the sign, but before getting signed, I should ensure that this is the right person who signed for me in the client consent, right? So that is the option. Is it clear? Shall we move to next one? Yes. The next question. The nurse has to place a wrist restraint on a client. The client tells the nurse that he or she does not want to wear the restraint. The best nursing action is to see the question is the best, which means the options what they gave here might be some of the good thing, but out of these all options we should find a best option, an appropriate option, which is 100% accurate to this scenario, this particular question. We'll see. First, sedate the client first. Do you think that if the patient is a little bit violent or something has happened, suddenly we will going to sedate? No, we are not going to sedate. Eliminate that that option. Then the next one, apply the wrist restraint. Here already the client said that I don't want. He will not accept or she will not accept. Then I will again going to apply the restraint? No, I am not going to apply again. So eliminate that. Then contact the client's family. Okay, when we will see this one, we will think, okay, that would be one of the good option, because maybe the family will come, they will sit with the client, they will talk with the client will become fine, and no need any restraint or any other action. But do you think that in this scenario suddenly we are first or best we are going to do this one? No. It may take some time to reach the client's family, or sometimes they will not reach today, they will come tomorrow. Or sometimes the patient, she is not okay, she don't want the family to visit right now. So what we have to go with? Some other alternative measures. So option 4 is the answer. Consider some other alternative measures. Like we will talk to the patient, we will listen their concerns, we'll spend some time with them to understand, to make a therapeutic conversation. And if the UAP or someone who is have a little bit time, they can sit with, especially in geriatric clients, they need someone who always with them to talk, to share their feelings. So in those scenarios, at least a UAP, if she is okay, if she have time, if she is not busy with another work, she can just sit with this client to listen what she's talking. Maybe this is not something serious matters this client is informing, but she needs someone to sit beside her for making her calm, making her comfortable. So the fourth option is the right and best action in this question. Shall we move to the next one? Yes. A hospitalized client tells the nurse that a living will is being prepared and that the lawyer will be bringing the living will to the hospital today for witness signatures. The client asks the nurse for assistance in obtaining a witness to the will. The appropriate response to the client is which of the following? See, living will, it is a statement, or it's like a consent which is in writing form, and it should be witnessed by a specific individual or should be notarized. That is the fact related to this living will. And the laws related to this living will, it's different from state to state, and many states have some federal laws and regulations based on this living will. Usually the nurses are not the right person, or nurses are not signing this living will as a sick witness or any part of this living will. As I mentioned before, there's some specific people or some notarized person will be for the right person to do this witness signature. So we'll see what is the options. I will sign as a witness to your signature. We already mentioned that these are not the right practice what we are doing in our nursing settings, so we can eliminate that. Then the next option is you will need to find a witness on your own. Do you think that when I will say this statement to the client, would the client, he or she will think about me, how arrogant this nurse? You will need to find a witness on your own. See, she might be sick, he might be sick, he's in the bed, and he was raised one of his concern to me, and I talk in such a way, it's not a good therapeutic conversation. So that one, leave it, eliminate that statement also. Then whoever is available at the time will sign as a witness for you. Did the nurse can say that one? She will be the right person to say that one? Did she have the right? No. So that is also not our answer. So what will be the answer? Most probably the 4. That is the last option. Yes, I will call the nursing supervisor to seek assistance for fulfilling your request. Yes, that is the right answer. Because the nursing supervisor, she will talk to the social worker, or she will arrange some other person who will be an authorized person to do this witness signatures. So this is the things related to living will. This is not that much important, even though you should have an overall idea about things. Is that clear? I hope this much enough for today, because if we'll discuss more questions at a time, we might fail. We might be go to dilemma, same like ethical dilemma, we might be fit over that. So we'll see tomorrow, or we'll see next video with some other questions. Bye bye.